Hello, I'm Dr. Sabnam Parvin, consultant in reproductive medicine and surgery in Genome Fertility Centre. And today we are going to discuss about single embryo transfer, why there is a shift towards it at present. So one of the complications of IVF procedure is multiple pregnancies. And this is due to the transfer of 2 or more embryos at a time to increase the success rate of IVF. Now, multiple pregnancies may lead to various complications. The complications can be for the baby as well as the mother. In case of the fetus, there may be more chances of congenital anomalies, or there is an increased chance of premature birth or low birth weight babies. Also, in case of the mother, there is increased chance of high blood pressure, increased sugar levels, and also placental abnormalities. So, reducing this is definitely a good option, and for that single embryo transfer is a key. Now what happens is, many a times the multiple pregnancies, in the higher order pregnancies, we have to reduce it by a procedure called fetal reduction. In such cases, we reduce the number of embryos to 2 or 1 in order to improve the ultimate neonatal outcome. But this can be an increased financial stress or financial burden as well as mental stress for the couple as well. Now, single embryo transfer is necessary for a few conditions, like in women who have uterine malformations, or in those who are suffering from Turner syndrome and may have certain congenital heart malformations, in patients who are already suffering from chronic illnesses. For these patients, if there is twin pregnancy, then the chances of complications are more, and therefore single embryo transfer is definitely recommended. Now, what is the criteria which is favorable for single embryo transfer? If the patient's age is less than 38, irrespective of age, if the embryo quality is good, in such cases we can go for a single embryo transfer. Also, where the number of failed transfers is less, that is also favorable for single embryo transfer. Now what happens is, if we transfer one single embryo, the chance of success is around 27 to 30%, and with increasing more and more embryos, the chances of success increases. Now in case of single embryo transfer, we can improve this success rate by the following procedures that we can do. First of all, we can grow the embryos to the blastocyst stage, so this may improve the success rate. Secondly, we can do the PGT-A, where we see the genetic makeup of the embryo, and only the ones with chromosomal where there is no chromosomal abnormality, we transfer those embryos. In such cases, we can go for a single embryo transfer. Our ultimate aim is to give a healthy child to a healthy mother, and single embryo transfer is a crucial step in this. Thank you.